December 2007, the Nova Scotia Department of Health initiated the Provincial Electronic Health Record System known as SHARE. SHARE stands for Secure Health Access Record. When implemented, SHARE will create an electronic health record for every Nova Scotian and others who receive healthcare services in this province. What is an electronic health record? An electronic health record, or EHR, is a secure and private lifetime record of an individual's health and care history containing clinical information from electronic medical record systems, or EMRs, across the healthcare system. So, why do we need an electronic health record system? Well, SHARE will allow authorized healthcare professionals to quickly access patients' consolidated health records regardless of where in the province they're being cared for, whether it's in an emergency room in Shelburne or a specialist's office in Sydney. The result will be better care, faster treatment, and improved access to information and services. The first release of SHARE will contain specific pieces of patients' information related to hospital registrations or admissions. That'll include lab and diagnostic imaging orders and results such as blood work and x-rays, as well as select clinical reports like discharge summaries, histories and physicals, and consult notes as they're available electronically to share in text format. Authorized healthcare providers will also be able to view patients' diagnostic images, such as X-rays or CT scans, contained in the Provincial Picture Archiving and Communications System, or PACS, through SHARE. SHARE will capture this patient information beginning on the day the system is released and from that day forward. Historical information associated with hospital visits and diagnostic images prior to the release of SHARE will not be included in the SHARE system, but will, of course, still be available through traditional means. The SHARE system will evolve over time and be made available for use by healthcare providers in stages. The long-term vision for SHARE is an integrated electronic health record that will provide up-to-date health information from electronic systems across all the healthcare systems in the province. SHARE will be a complementary system for healthcare providers. It will not replace existing EMR systems, rather provide a holistic view of a patient's information to complement those systems. The SHARE system will be private and secure and allow authorized healthcare providers to access a patient's information when and where it is needed. So, what are the benefits of SHARE? SHARE offers a variety of benefits for patients, healthcare providers, and healthcare administrators. For the patient, SHARE provides an enhanced delivery of care resulting from improved provider access to health information from across the continuum of care of the provincial healthcare system, no matter where the patient's being cared for. SHARE will offer an improved quality of care as healthcare providers will have access to their patients' lifetime health and care history. With improved access to information for healthcare providers comes improved access to services for all patients. One example may be a reduction in test duplication. That's going to help reduce wait times for services. To speak to the benefits to healthcare providers, we spoke with Colchester Regional Hospital Chief of Staff, Dr. Sean McCormick.
As a healthcare provider, I think that the SHARE site can help transform the way I provide care to patients. In the past, I've had to rely on the patient themselves telling me about results of tests or investigations or treatments in the past, and sometimes that knowledge has been incomplete. And being able to actually see the results myself and know exactly what they said helps me and helps my patient receive better, more efficient, safer, and obviously higher quality care. As all physicians know, healthcare is very data rich, but information sharing poor. And the SHARE portal will be a way to really and truly share healthcare information from the different places that the patient has received care and the different providers that have provided care to the patient, so that the physician or other team member who's caring for that patient will have more complete information and hopefully be able to make better quality and safer decisions for the patient.
Sandra Cascadden from the Nova Scotia Department of Health offers some insights to the benefit for the healthcare administrator.
The Electronic Health Record, or the SHARE initiative, will provide many benefits to the system, including the administrative side of the house. There's a lot of time currently spent in gathering information in a paper format, Now, with the electronic system, we can move information much more efficiently and effectively across the province. So it will support the administrative benefits as well as patient care and provider benefits as well.
A big area of concern with any electronic system is security. SHARE will be protected using administrative, technical, and physical safeguards. Administrative safeguards include strong password requirements, confidentiality agreements, condition of use agreements, and auditing of user access. Technical safeguards include firewalls, antivirus software, audit logging, and designing the system to control access to patient information. Physical safeguards include monitored and restricted access to computer servers. Whether patient information is kept in a paper-based format or in an electronic format, patients have the right to have their personal health information treated in a confidential and respectful manner. As is the case now, healthcare providers will have authorized access only to the information necessary to perform their role in supporting patient care. What will be different is that they'll have timely access to relevant aspects of a patient's health history, no matter where the patient is treated in the province. Everyone who will be using SHARE will be assigned a username and password, and will be provided the appropriate level of access according to their role in care delivery. All users of SHARE are also required to sign conditions of use agreements and receive privacy training to reinforce appropriate use of the system. Access to SHARE will be given to healthcare providers across the healthcare system for the purpose of patient care. Over time, electronic access by patients to their health information is envisioned. In the meantime, just like today, patients can access their own information through their family physician or by requesting access to their records at the hospital where they were treated.